Hey, what's going on, everyone? Drew here, back at ASPS 2017 in the beautiful Orlando. I'm joined by Dr. Lickstein. Welcome. Thanks for joining us.
Great to be here.
Yeah, so how's the show going so far?
Really enjoying it. Always nice to connect with old friends, learn what news going on. It's just a nice educational break.
Yeah.
Really a lot of fun.
Absolutely. Any sessions that you've attended so far that you particularly enjoyed?
A lot of focus this year on how to integrate social media in your practice, how to use it the best way, in addition to a lot of talk about the power of fat grafting.
Oh, awesome. So is that fat grafting something you do already that you're...
We do it, but it appears that you can pretty much put fat anywhere you want.
Yeah, so they're starting to think of different ways rather than just maybe the butt, maybe just...
Yeah, I think a lot of people initially thought of Brazilian butt lifts, but
Right.
really is a very powerful tool for facelifting and adding volume. And we think of people over the years that they really sag, but they also lose volume in their faces. And
Sure.
What's useful is having a little bit more shape to your face.
Gotcha. Cool. So they're starting to think about fat grafting for the face then, because they still do it a little bit for the breast, right?
Done for the breast, for breast reconstruction to help fill defects, and even for a little bit of augmentation.
Okay, cool. Awesome. Good stuff. You want to talk a little bit about
your... have plenty of fat.
Yeah, no kidding, right? Do you want to talk a little bit about your practice? What things you're specializing in?
Really excited. We opened the new office in March in Palm Beach Gardens, Florida. We have a full spectrum practice that includes both the reconstructive side. We really have a passion for breast cancer.
Okay.
In Florida, we see a lot of skin cancer patients, but really providing the state-of-the-art and the best aesthetic treatments as well. So a lot of breast surgery, revision breast surgery, facelifting. We've also added a whole spa component to our office.
Cool.
With a massage therapist, cool sculpting, hydrofacials, and the halo laser.
Awesome. How are you liking the halo laser?
I think it's great. One of the really powerful tools available to us. It's good for all skin types, so whatever skin type you have, you can have the treatment. There's the ability to do the treatment with just local anesthetic, so you don't need a lot of shots to have it. And then really controllable downtime, but most people between 5 and 7 days are wearing makeup and noticing the improvement in their skin.
So who's the ideal candidate for that, and what is the treatment exactly for it?
So the ideal candidate is really anybody that wants to improve the appearance of their skin.
Okay.
But the treatment takes about 45 minutes. We apply topical lidocaine and then basically pass the laser over. And what's really neat about the halo is it's a hybrid laser. It's the only one like that. So it's doing two things at once. It's treating the layers on the surface of your skin to kind of take some of the dead tissue off and resurface it, as well as drilling holes deeper to stimulate new collagen growth. And there's really no other laser that does both at once.
Beautiful. Sounds good. I need to check it out. All right, let's pivot here for a little bit. I'm going to ask you some fun questions, personal questions about yourself. Why did you get into plastic surgery?
I got into plastic surgery because I was really interested in a field that required artistic ability and the way to think artistically, as well as the opportunity to operate on patients from head to toe.
Mm-hmm.
There was no one part of the body that was involved. And everything that we do counts, and it shows. The other really neat part to me is you see people from little people to 100-year-old people, and there's really no other specialty like that.
Right. Everybody still wants to feel good no matter what age you are, right? Look and feel good.
Right. We have, whether it's a cosmetic operation where we make someone look better or whether we restore something that's been lost, we really get to a tremendous sense of fulfillment for what we do every day.
So you brought up the artistic side of plastic surgery. Is there any other kind of unique artistic talents that you have?
Not a whole lot. It's really interesting. Like everybody thinks you'd be a painter or a sculptor, but no, I like to draw and doodle a little bit, but other than that, it's really funneled into the work.
Cool. Any other hobbies you like to do?
I like to run. I love sports. I'm a big Miami Heat fan.
Okay, awesome.
Dolphins, but that's a little painful at times. Maybe today again.
With Jay Cutler, yeah.
Okay, Cutler, happy we got Cutler, but still.
Yeah.
But just enjoy spending time with my family and really taking a mental break from work when I'm not working.
Cool, awesome. What's one thing your patients don't know about you that you want to tell them?
It's one thing they don't know about me. Took dancing lessons with my wife for
Nice.
several years.
I've been wanting to do that.
Yes.
What kind of dancing?
Ballroom dancing.
Okay.
We did it for several years, and now we can stumble our way through maybe one dance.
Nice. So like Dancing with the Stars style.
Right, but it was great spending time together and being able to do that.
That's cool. Yeah, I just got married a year ago, and my wife and I have been talking about wanting to do that. It sounds like a lot of fun.
A little difficult at first, but once you get going, it's fun.
Cool. If you can be any kind of animal, what animal would you be?
Any kind of animal? I'd like to be a dog because we all have dogs, and I would just love to know what they're thinking when
Yeah.
they look at us. They can't
Right?
talk, they can't tell us, but they give us that look.
But you know they love you, and they know they're happy to
You think
see
they
you.
love you, but they might be saying things about you and you really have no
You're
idea.
saying each other talking amongst each other with their growls. They're
Yeah.
really,
And how much do they really know? What's going on?
yeah. So do you have dogs?
We have a dog. We have a little Chihuahua. So
Cool.
I always joke around that I have about 10 female employees at work. I have 3 daughters, a wife, and a female dog.
Four-legged daughter.
It's the only way I can love all these women.
Yeah, right. All right, last question. Where do you see the industry going in the next 5 to 10 years?
I think that it continues to grow. So, I think it's really going towards less invasive treatments and more that can be done in the office. People want less downtime, but they still want to get results.
Sure.
So it's really incumbent upon us to investigate what is safe and what works.
Yeah.
But I think that people are busy. I think that's why we've seen tremendous growth with cool sculpting, which we have in our office too.
Yep.
Is that a treatment that can be effective, but that you can get up, walk right out of the office and go back to the gym, to work or your family, people are really attracted to.
Sure. Cool. Awesome. All right. Thanks, Dr. Lickstein. Thanks for
Enjoyed it.
joining us. Have a good rest of your meeting.
Thanks a lot. You too.
Yeah, you got it.